But if liberals hate it and conservatives have yet to be won over by it, maybe we should just junk it to Republican Florida Senator George LeMieux. What do you make of this right now? Where things stand right now, Senator, what's the status?
Well, right now, just steps away from where I am here in the United States Capitol, Harry Reid and the Democrats are trying to circle the wagons and figure out what's going on with this new so-called revised public option. Most of the Democrats didn't know what this was today. They were walking around just as much in the dark as we Republicans. This process isn't open and transparent. It's not what the president wanted when he said we'd all be in a conference room and the major TV networks were there to be able to watch who was standing up for special interests and not the American public. It's a secret behind closed-door process. What we do know is disconcerting. We hear that they're going to raise the eligibility for Medicaid to 150% of poverty, which the states can't afford, that they're going to make Medicare eligible at age 55, a program that's already in trouble financially, a program that their plan takes $500 billion out of, and now we're going to put more people into it. So
bottom line, Senator, if you could steer us through this, that is going to be the public option here, right? Medicare has a lot more expanded role, right?
Yeah, more Medicaid, maybe more Medicare. But you know, Neil, this is really, to me, it's the sideshow. It's not the circus. The circus is how bad this bill is. If you and I or any other reasonable people in this country were to sit down and come up with health care reform, something we need, we would probably not raise taxes. We would not cut Medicare, and we certainly wouldn't come out with a bill that was going to make the cost of health insurance more expensive for many Americans and cut it for nobody. That's not health care reform, so it's a crazy process.
But it's a watered-down process too, right, Senator? And I guess it was watered down enough on this public option, linguistic issue, enough to get those 60 votes. Now, I imagine the conservatives, right, I imagine the conservatives you might gain doing this are going to be offset by a liberal or two like Nelson who you might lose. So where do you handicap it?
Well, what I'm worried about is the American people losing. I'm worried about creating this new $2.5 trillion program that isn't health care reform, it's just Medicaid for the masses. That's what concerns me. I mean, I remember Justice Brennan once said that making a Supreme Court decision, what does it take to make a good Supreme Court decision? He said 5 votes. Well, Harry Reid must be in that school because all he's trying to do is get 60 votes by heck or high water, and it doesn't matter what's in the plan. The president said make history, but not necessarily good history. They are just rushing to get anything they can done. Unfortunately, it's going to be the American people, I'm afraid, that are going to suffer.
But I do read in between the lines, Senator, and you're a lot closer to the action than I'll ever be, but that they've given up on this idea of a simple majority, right? I mean, so they are going for the 60. Are you encouraged by that?
Well, if they went for a simple majority, that would be a complete disrespect of what the Senate is, which is the sober body that listens and debates and thinks through thoughtfully and requires more than a simple majority. That's what our founders intended. So we're still on the path, is all I can tell, that we're going to go towards 60 votes. But the problem is the Democrats have 60 votes.
But do you think those 60 votes are there now, the way things stand?
No, I don't think they're there. I think they've got problems with 4 or 5 Democrats. And those Democrats, their conscience is bothering them. And they're going home to their states, like I go home to Florida, and their constituents are telling them, this is a bad bill, it's not reform, don't vote for it. And we have to rely upon the good consciences of those senators to do the right thing and not vote for this bill.
All right. Congressman, thank you. Senator, thank you.
Thank you, Neil.
I just demoted you, sorry.
Thank you.
Very good having you.
That's okay.